My name is Laura, I work for GfK NOP, and I'm just going to tell you about a couple of projects that I've worked on over the last couple of months. The first one I'm going to tell you about is NHS numbers. Back at Christmas time, we received a brief from the Central Office for Information, and they wanted to carry out a research project which was an evaluation of their NHS numbers communications pilot campaign. The brief came through, we had about a week to respond to it. It was a particularly interesting brief, and I was very lucky that I had it and I got to write a proposal. There were several companies that went in for the pitch and we were lucky enough to win it. So a little bit about the project.
Did you actually present to the prospective client at that point?
No, we were quite lucky that we won it without having to go to do a presentation pitch, although for other projects we have had to do the pitches. Basically, the NHS have put together a plan in the case of pandemic flu, and part of this was that they don't want people going to the doctors if they've got symptoms of pandemic flu. They'd rather people called an NHS helpline, which is pandemic flu helpline. One of the things that patients would need to give is their NHS number, and the NHS is very aware that not many people know about their NHS numbers. Quite often it gets confused with national insurance numbers. So we carried out a pre and post evaluation of their communications campaign to see whether they've managed to raise awareness. So back in February we carried out about 800 interviews with people living in the northeast of England, and that was just to get baseline awareness of whether people had heard of NHS numbers, whether they knew anything about it, what they looked like, would they be able to produce it, that kind of information. That was spread over about a 2-week period. Immediately afterwards, the NHS started their communications campaign. They sent out letters to everybody living in the northeast who were registered with a local GP, and in the letter it just said a little bit about, you know, this is your NHS number, it's important that you keep it safe, you know, you'll need it if you go for care at the hospital, that kind of thing. About 2 weeks after they'd received the letter, we then recontacted people in the northeast, again looking to see whether they knew about their NHS numbers, did they know what they were, how confident they were in being able to find it. This sort of work we do quite often, especially for the Central Office for Information, because they evaluate marketing campaigns, and it was very pleasing to find that actually, yes, their campaign had done well in raising awareness. So we had our initial wave, then they did their communications campaign, we did a follow-up post-wave of research, and then we did a presentation of the results to the key people at the NHS, Department of Health and the pandemic flu team, and we followed that up with a full written report. We quite often do that for clients, give them a presentation so that they're aware of the headline findings, and then follow it up with a full detailed written report in case they want to find the finer details.
And Laura, what sort of analysis did you do on the numbers that you got?
For this project, it was the sample size was relatively small. We only had around 800 people at each wave. While that sounds quite a lot, it is still relatively small for being able to do sort of detailed statistical analysis. So what we did was SIG testing, significance testing. We looked at subgroups within each wave, so for argument's sake, males and females within each wave, and then we also looked at the results across waves to see whether there were significant differences across waves, and that was just your standard significance testing at the 95% level.
So Laura, hypothetically, if you were recruiting for a new member in your team, what kind of person would you look for?
We'd look for somebody with good communication skills, because that's key for client management, and strong analytical skills. Somebody who's got to be comfortable with numbers, be prepared to get involved, look at statistical testing, and to be able to interpret the results. Of course, we'd want somebody who's a good team player as well, who's willing to get stuck in with the rest of the team.